flu season. It often peaks this time of year, so we need to know what to do to stay healthy and away from all of that. What do you do if someone in your household is sick? And how do you prevent it from spreading through the rest of the household? Well, joining us today to talk about flu and respiratory illnesses is Dr. Cynthia Snider, Cone Health Infection Prevention Medical Director. All right, so to start, where are we currently with the flu numbers? Because it seems like everybody I know knows someone who's had the flu.
Yes, I agree that the numbers are still pretty high in our community, and I don't think we have peaked. The CDC did release some data about 10 days ago, and since the freeze, we still know that the data suggests that those numbers are still increasing. Within our health system, of pediatric cases that were tested, 60% are positive, and with adults, it's about 40%. So if you have like fevers, cough, and just feel very fatigued, all those are pretty consistent with flu symptoms.
Yes, I'm hearing all kinds of people having it. They're stopping kinds of travel because people from somewhere else already have it. So if someone has not gotten the flu shot yet, is it too late to get it, and why does it still matter?
It still matters. It's not too late. We don't think we're going to peak yet. Still have a few more weeks until we hit that apex of this flu season, and it takes about 7 to 10 days to get full immunity. And I feel like it's still important because not many people took the flu vaccine this winter. So especially if somebody has other health conditions such as heart disease, especially lung disease, that makes you more primed to having complications of flu. And we just want to protect everybody so that they don't have to be hospitalized or more severe infections with it.
Okay, so let's talk about the differences between the flu and other respiratory illnesses like COVID or RSV, both of those also in our community as well.
Correct. I would say in the past few weeks, the RSV numbers have been trending down. It's generally it peaks about now and starts trending down, so it's more likely to be influenza at this stage. This winter is the first winter since 2020 that we haven't had a massive COVID wave. And I think that's part of having multiple seasons of COVID. Our immunity is primed. We had a large COVID wave in the fall, and I think that's been protective. Only about 3 to 5% of our COVID tests are positive. So in fact, now it's more likely just to be a cold.
Okay, so flu is it at the moment. If someone starts feeling flu-like symptoms, and let's talk about what those symptoms are, let's then talk about also what steps they should take.
I'm sorry, can you say that again?
The flu-like symptoms, what are they and what steps should we take?
Yes, so flu-like symptoms are those, comes on quite quickly. I think people feel that they can have some nasal congestion, but also fevers. They feel like bone aches, muscle aches, very fatigued, and probably comes and having cough as well.
Okay, and so if they have those kinds of symptoms, like what should they do?
We would recommend, the recommendations vary. So if somebody is otherwise healthy, I would just stay home, stay hydrated, take some medicines to keep your fever down, and stay home and not go back to work and potentially put others at risk for getting influenza. For kids and adults who have health issues, it's important to be seen by either a primary care provider. You can do a telehealth visit, and also potentially urgent care to be evaluated, especially if it comes to being short of breath, or if you're noticing to the fact that you're not able to do your day-to-day activity. It's important to be evaluated. The one thing that's really important this season is that there is an over-the-counter flu and COVID combined test that you can find at pharmacies that is pretty accurate and very useful.
Okay, so here's the thing. I've heard lots of people say, well, so-and-so has the flu, but the rest of us so far haven't gotten it yet. And they're all living in the same house. How does a family prevent spreading the flu within the household?
That is a great question. And sometimes it's challenging to do. So the key thing is that the person that's sick, if they are joining the rest of the family, it's that old school of wearing a mask, making sure proper hand hygiene and cough etiquette. I think for children, it's tough. Parents are always going to just be caring for them and they may still be exposed and possibly get sick. I think for patients who have like heart disease or lung disease or even who are immunocompromised, it's best to contact their primary care doctor to see if they need to take medicines as prophylaxis to prevent getting flu.
How long should someone stay home from work or school to prevent the flu from spreading to others?
I think the key thing is making sure that somebody is not still having fevers and there's improvement in your symptoms. I think it is also a very good idea to wear a mask for 5 days since the onset of your symptoms, and that will minimize the risk of others from getting the infection.
And when you say no fever, you mean no fever without any kind of like Tylenol or anything trying to bring it down?
Correct.
Okay, so you have to be off the meds and no fever before you should go back to work. What steps can people take to protect themselves if we're in a public space, and we're in public spaces, we're going to the grocery store, we're at the gas station, all that kind of stuff with all this stuff going around?
It's similar to what we've done in the past for prevention is wearing a mask and also proper hand hygiene. It's very easy to touch something that may have like some virus from somebody else, and cough etiquette, obviously. So I think the key thing, especially if somebody is working in a tight space and there are a lot of other people that may have symptoms, it's important you can wear a mask to protect yourself.
All right, cough etiquette. That's the whole coughing into
Old
the
school,
elbow,
right?
right? Mm-hmm.
Right.
Okay. If we haven't stocked our medicine cabinet yet with items in case someone gets sick, what are some of the things that maybe we should be considering?
And so I think a very good thing would be having something that works for treating your fever. So be it acetaminophen, which is also like Tylenol or ibuprofen or Advil. And then it's really looking at what the symptoms you may have. If cough is your issue, you can take a cough syrup. And the key thing is making sure that you can ask the pharmacist that it doesn't interact with some of the blood pressure, if you're taking blood pressure medicines.
Gotcha. Okay. And let's talk about a few common myths about the flu, or maybe even home remedies that you'd like to set straight.
A lot of people say, I don't want to take my flu vaccine because I took the vaccine and the next day I felt poorly and had flu. And again, similar to other vaccines, is that once you get the injection, it's supposed to like mount your immune response. And you can have like achiness in your arm and feel like you have fever and be down for about a day or so, but it does work in protecting against hospitalizations and death from flu. And so it's still very important to get it. I think anybody who's had flu would tell you I would take the vaccine any day in order not to get so sick again. Mm-hmm. The other aspect of it is that the flu vaccine is definitely not 100% effective. It is closer in the range of like 40 to 60%. And realizing that for some it can work. And again, the vaccine is to help minimize the length of being sick, the length of being infectious, and to prevent hospitalization.
Mm-hmm. You touched on this a little bit about being hydrated. I think that's something that we forget about when we're sick because we just feel awful and we just want to sit there.
That's correct. I think a lot of people, when you're having a fever, you do have like this insensible loss of like fluids, and just like perspiring. And so it's so important to stay hydrated, possibly also with electrolytes and, being your Gatorade product or something close to it. But anything to do, and rest is so important. So if somebody does have the flu, I think the best thing is try not to attend too many things and just stay home and take care of yourself.
Okay, so we're talking flu. We talked a little bit about RSV, COVID, not as much of an issue as of now. Flu seems to be the big thing. Is there anything else that we should think of as, we kind of like wrap this up about flu season?
So, again, for folks that have like other health problems, it's important to check with your primary care doctor that you would benefit from getting the antiviral, which is called oseltamivir or Tamiflu. The one key thing, though, is that those medicines work best if you contact your provider within the couple days of having symptoms. If you wait it out 3 or 4 days, it doesn't really make a difference. You just have to, let your body heal itself.
Gotcha. Okay. Well, we thank you for your time, of course. And if you missed any of this, maybe you need to send it to a family member. We're going to have it in the To Your Wellbeing section of our website. Right now, we're going to take a quick break and take a look at that forecast.